Every year, the Bill and Melinda Gates Foundation releases its Goalkeepers Report, outlining a focus of its philanthropic efforts and where it sees the most acute need globally. This year's report focuses on the issue of malnutrition, highlighting the UNICEF finding that more than 400 million children, that's 2/3 of those in the world, suffer from some kind of malnourishment. And this comes as spending on global health has waned. As Bill Gates writes in the report, when historians write, quote, about the first quarter of the 21st century, I think they may sum it up this way: 20 years of unprecedented progress, followed by 5 years of stagnation. I'm joined by Mark Suzman, CEO of the Gates Foundation, to talk more about the report. Mark, first of all, thanks for being here. I do want to start with what Bill talked about, because it was quite striking, where he talks about whether the global health boom is over for good, for how long, what could pick things up again. Give us some insight into that thinking, into sort of the pace of what we have seen on global health spending.
Absolutely. So I think what the world doesn't often understand is just how extraordinarily positive the first 2 decades of the 21st century were, in terms of having the lower and middle income countries catching up to high income countries in health outcomes. We saw preventable child mortality dropping from 10 million kids a year dying to under 5 million by 2020. We saw huge progress in the fight against HIV, tuberculosis, malaria. We saw huge progress in poverty reduction, and that was across Africa, Asia, Latin America. And unfortunately, the data in our report shows that has really stopped since 2020, since the COVID crisis. And the last 5 years have been broadly stagnating. And a big cause of that has been a big drop in financing into global health broadly. The Gates Foundation has been increasing its financing, but unfortunately, governments and other partners have not been. And that is one of the big challenges we face.
And I've seen some research on an individual level as well that philanthropic giving, at least here in the United States, has also dropped off. When you're talking about, though, countries giving, large donors giving, how do you jumpstart that again?
Well, the first thing to jumpstart is to highlight how critically important it is. Health is actually arguably the most important long-term economic investment any country can make in its own citizens and the world can make in the global future. That the report cites data showing that the current challenges of malnutrition, and you cite the 400 million kids who don't get enough to eat, but worse, there are 148 million kids who suffer from stunting and wasting, and that means they've reached a stage where their bodies will never fully recover and their brains will never fully grow to their full potential. And the economic cost on that is huge. It varies between 3 to 16% of GDP across multiple countries, and it goes into the trillions of dollars.
And when you talk about solutions for this, one of the solutions that's outlined in the report, some of these are what seem like pretty simple, low-tech solutions, getting specific vitamins to expectant mothers, for example. What are some of the biggest roadblocks to getting those kinds of practices enacted?
Yeah, that is exactly the case we're trying to make. The solutions to these things are not that expensive, and they're very easy to roll out in theory. So what the one you cite is, we show that if you have a simple multivitamin, which has sort of 15 different nutrients in it for pregnant women, that costs just $2.60 for an entire pregnancy. And it has a massive effect on terms of healthy birth and then growth for the infant. And the challenges of rolling out is, first, we need to get governments to adopt that as a major policy. The World Health Organization has recommended it. Many governments have not yet adopted it. We need global funders to be able to step in and help support that, because in many low-income countries, many of which have faced huge debt crises and other fiscal crises over the last few years as a result of, in the wake of COVID. We need to kickstart that with some international support, and we highlight a new child nutrition fund that we've set up with UNICEF and some other partners, including philanthropists. And I think that combination of political prioritization and financing is really all we need.
There's also a lot of research that you all cite, this emerging research into the gut microbiome and how important that is, not just sort of the vitamins we traditionally think of, or things like iron and folate for expectant mothers, but also having good gut health. How do you then incorporate that research into getting, again, things that will help that flourish to the people who need it?
Yeah, well, that's another reason why we cite malnutrition as the focus of the report, because it's actually an incredibly exciting time in research and development for malnutrition. The work on the microbiome and the gut, which itself has trillions of bacteria in everyone's gut, which turns out to have a huge dimension on their health. So, for example, we found that malnutrition now contributes to over half of preventable childhood deaths that still exist, because when your gut health isn't appropriate, you can't actually absorb a vaccine fully. You often can't absorb the nutrients from other enriched foods. And so what this research is showing, and the Gates Foundation has really been funding a lot of the research around maternal and child health. The world is funding a lot of research in areas like obesity, but on maternal child health, we're very significant funders. And that's showing already some interventions, like some new probiotics that can be delivered to infants at birth, which actually can create a healthy gut, make them much more likely to be resilient if and when they are vaccinated, and then able to be resilient to any diseases like malaria they might encounter. And so that's just the first stage. And we think over the next decade, there's going to be a range of new interventions coming out of that research that can be transformative in the fight against global hunger.
And then finally, Mark, I want to ask you more of sort of an organizational question about the foundation, because of course, Melinda Gates has stepped aside from the foundation. You're in the process of renaming it. And I'm just curious, from your perspective, from an operational perspective, from an orientation perspective, in terms of what you guys are focused on, talk to us a little bit about how things might have changed or are changing.
Yeah, well, the major focus really isn't changing at all. And that's something Melinda was very clear on as she decided to leave, which was for personal reasons, as she stated, and that she is very excited about where the foundation is going and what it's focused on, and the priorities that she and Bill have set together, including around everything we've been discussing today around nutrition and the focus on women and children in particular. Those are not going to change. We at the Gates Foundation are absolutely committed to stay focused on these needs and challenges. In fact, more than ever, for exactly the reasons you cited at the start of the program, that the needs are greater, even if we have made great global progress. And we think our voice and our financial resources, and hopefully our commitment to innovation and transformation will really help with that. And I know we have Melinda's full support as we move forward in that.
Mark, great to see you. Thanks for joining us.
Great. Thanks so much for having me.